And hello there. It is Friday, and that means it is time for our Lunch and Learn. And I am your host, Dr. Polly Heil-Mealey at Abundant Health and Wellness. Now, Abundant Health and Wellness is located in downtown Humble at Main Street and Avenue C. So we have some people who are wanting to know about fibromyalgia. So I'm going to talk to you a little bit about it, and I'm going to talk to you a little bit about how we would address it here in the clinic. Now, I've titled this The Enigma of Fibromyalgia because there's really no criteria to be diagnosed with fibromyalgia. You would think that it is an autoimmune disease. Hi, Monica. Thanks for joining. You would think that it would be an autoimmune disease, but it is not listed in the autoimmune disease because I would imagine there are no ANA antibodies, which is the gold standard for an autoimmune disease. However, it is a malfunction of the central nervous system. And so the central nervous system, for those of you that don't know, is it's the brain, and it's the spinal cords and all of the nerves that go through that. So your cranial nerves and then all of the nerves down your spinal cord. Your central nervous system takes care of all of the processes that you don't have to think about. So how many times your heart beats, how many times you blink, how many times you swallow, how you make your enzymes, how you make your amino acids, how you how you make your urine, how you process your blood sugar, all those things your body does automatically. So fibromyalgia is a breakdown of that central nervous system. So I just want to give you some information on that. So fibromyalgia affects an estimated 10 million people in the United States alone. Somewhere between 75 and 90% of those with fibromyalgia are women. It is the most common symptom that is widespread and is sometimes debilitating is pain. So when you go to the doctor and you say, I've got pain, my skin hurts, my muscles hurt, if it's gone on for more than 3 months, they're just going to say, oh, well, you've got fibromyalgia. Now, fibromyalgia comes from two words, and fibro meaning muscle and myalgia meaning pain. So muscle pain, that's what fibromyalgia means. Fibromyalgia may occur with irritable bowel syndrome, chronic fatigue syndrome, Sjogren's syndrome, and Raynaud's syndrome. Now, all of those are autoimmune diseases. So in my head, I would look at it as an autoimmune disease. Now, the medical profession does not classify it as that because there are no ANA antibodies, which there are ANA antibodies for all of those other diseases. So, we're just kind of looking at that. So, genetics is believed to play some role, but fibromyalgia may also arise from physical or emotional trauma. Hey, Lorraine from Mexico. Thank you. Hola. We'll say hola to you. Thank you for joining us. I see other people. We've got other viewers, but you're not coming across my screen. So thank you for watching. That makes me feel really, really good. Oh, Tom was watching. Thank you so much. All right. So fibromyalgia, just to give you some more perspective, affects 2 to 4% of the people. So it's not widely understood, and it does not affect a large number of the population. But if you have it, it's very, very debilitating. This is from the American College of Rheumatology. Now, it's not classified as autoimmune or an inflammatory-based illness, but research does suggest that the nervous system is involved. So when you come to me and you have a diagnosis, which I love that because I'm not able to diagnose and prescribe, right? I'm not a medical doctor, I'm a naturopathic doctor, and so for those reasons, the FDA does not let me diagnose and prescribe, and I would be prosecuted for malpractice if I tried to do that. So we don't try to do that. But if you come to me and you say, I have been diagnosed with fibromyalgia because I know it is a central nervous system disorder, then what I'm going to do is I'm going to be looking at your central nervous system and see if it is functioning properly. Now, one of the things that we do is we use EAV. Now, EAV stands for electroacupuncture according to Dr. Voll, V-O-L-L. Now, Dr. Voll was a German physician, and he developed this technique using electricity and using the traditional acupuncture points. So, no, I'm not going to be sticking a needle in you, but I have a probe, and I will be touching the acupressure points on your hands and on your feet with the probe as you are holding another electrode. So we've got a little small microcurrent going through the body. And what we do is we test these acupressure points to find out if you're getting the right voltage. So the central nervous system, as I said earlier, keeps everything in balance and keeps everything going in the right direction. So one of the points that we would check would be the hypothalamus point. Now, the hypothalamus point is right here over your ear, and you've got, this is my right side, and you've got one here. So your brain crosses, your nerves cross over the corpus callosum, which is in the center of your brain, right? Emotional trauma, physical trauma, spiritual trauma, all is located in that corpus callosum. So sometimes, and I'm theorizing here because everybody's different, and that's why holistic medicine is different, because everybody is different. But what I would check is I would check that hypothalamus point, and I would see if it is balanced. If it's not balanced, then we would want to get it balanced. Now, when you come in and you have an appointment with me, that's one of the first things that we check. We check to see if your hypothalamus is balanced, because if it's not, then no matter what I do, you're not going to get well, because the messages are not crossing over that corpus callosum. So sometimes it's your minerals are out. Sometimes it is your probiotics are out. Sometimes you've got the MTHFR dysfunction, and so that doesn't let your cells do the work that they need to. Sometimes it's dehydration. Your neurotransmitters aren't doing what they need to. So we've got all kinds of tools. Sometimes it's emotional trauma. Sometimes it is spiritual trauma. So we've got all of these tools to find out what will bring the hypothalamus in balance. And so when you get the hypothalamus in balance and the body's able to get the messages that the body needs, then the body doesn't get confused. So I'm going to tell you a little bit more about fibromyalgia, just to let you know. It is common neurological health problem. So neurological means it affects the brain, or it starts in the brain. The pain and the tenderness tend to come and go throughout the body. Most often, the people with chronic long-term illness are fatigued, very tired, and they have sleep problem. Now, the diagnosis can be made with a careful examination. So fibromyalgia is a diagnosis that is a last resort diagnosis, because they'll look at your blood work, they'll look at your ANA antibodies, and if there is nothing wrong in the blood work that they can attribute to any other disease, they'll just put you in the fibromyalgia bucket, right? And that's what you're diagnosed with. So these are some of the symptoms that you have: tenderness or pressure affecting your muscles, sometimes joints, sometimes your skin; severe fatigue; sleeping problems. When you wake up, you don't feel like you've been refreshed; problems with memory or thinking clearly. Now, a lot of people come in and they say that they have brain fog. And a lot of times what we find is that is a heavy metal toxicity, and we do that by the frequencies of what is going on in the body. And when we give you the appropriate remedy, presto changeo, the brain fog just goes away. But these are some other symptoms. You can have depression, anxiety, migraine, tension headaches, digestive problems, irritable bowel syndrome, commonly called IBS or Crohn's. Also, you can have GERD, which is gastroesophageal reflux disease. So we call that heartburn, okay? You can have a irritable or overactive bladder. You can have pelvic pain, and you can have TMJ. So that's when you clench your jaw, you wake up and your jaw is really hurting. You've got face pain, jaw clicking, ringing in the ears, okay? So people do not know what causes fibromyalgia. So in holistic world, we know that when your vibrations are not at the proper frequency, then things do not function the way they should. So any kind of dysfunction in the body can lead to imbalance in other areas where your body's not getting the right messages. And so this could be the cause of the muscle pain. So I would think, and you might think too, that because there is pain, there would be inflammation. But according to medical reports, inflammation is not the issue. And so we need to kind of figure out what is the issue. That's why we do the testing. All right, there's most often a triggering point that sets off the fibromyalgia. It may be spinal problems, arthritis, injury, or other types of physical stress. Emotional stress also can trigger this illness, and the result is a change in the way the body talks to the brain and the spinal cord. So let's talk about that. We have a protocol here in the clinic called Restoring Cellular Communication Pathways. So a lot of times in our experience, when the body starts to break down, when things start to go haywire, it's because the body forgets how to talk to the different members. Now, what impedes that? Well, low minerals impedes that. Heavy metal toxicity impedes that. Parasitic activity works with that. Fungal activity impedes that. So all of us have all of these things to some degree or another. Now, I had a gentleman in early this week, and he said, well, I went on the mission field and I came back and I had parasites, but I haven't been on the mission field in forever, so I probably don't have parasites. Well, yeah, we have parasites here in America too. So anything like that impedes the communication of the body. So I think it was Dr. Popp, P-O-P-P, you'll have to check me on that, but I think it was Dr. Popp that said any disturbance in the body is because the frequencies are out of balance, or we have extraneous frequencies in the body. Now, everything that is alive has a frequency, okay? Everything. So if it is a parasite, it has a frequency because it's alive. If it's a mineral, if it's a metal, if it's a bacteria, whatever, everything is made up of a nucleus, protons, and electrons. And we know from our chemistry classes that those electrons are always in movement, so they're always generating energy. So this energy can be productive, as in we've talked about last week on our probiotics, those good bugs that enhance our system. It brings the vibratory frequencies that we need. It brings vibratory frequencies that inhibit the candida and the other fungus, right? So those are good, beneficial frequencies. But if we have heavy metal, I tested a lady yesterday and she had the frequency of aluminum and arsenic. And so, how did she get them? She wants to know how she got them. I don't know. It could be from her diet. It could be inherited, all those kind of things. Lorraine's saying that she is getting treated for amoebas. Yes, we all have amoebas. If you have an autoimmune disease, you have amoebas, okay? Why do I say that? Because your medical test is called ANA antibodies. ANA stands for anti-nuclear, Okay, so anti-nuclear antibodies, that's what ANA stands for. So if an organism does not have a nucleus, what is it? It is a single cell organism, and those are amoebas and those are protozoans. So those are little bitty baby parasites. They're one cell organisms, but they have a frequency that disrupts what's going on in your body. So I think I've gotten off my track now, so I need to go back to my notes. Fibromyalgia can affect your quality of life. It is considered medically benign. Now, if you have fibromyalgia, I'm pretty sure you don't think it's benign because it absolutely disrupts your day. I know people that have fibromyalgia and they're exhausted and their body hurts and they have really, really poor quality of life. I have a chart here. This is a list of common conditions associated with fibromyalgia. I'll just show you this right here. I can probably get Tracy to post this after the video so you can look at this. But a lot of it, you have allergies, female syndromes, and osteoarthritis, a lot of autoimmune diseases. That's why in my head, I would classify it as an autoimmune disease. Your body is confused. You're not able to get your body to talk properly. So this is why we do the restoring cellular communication pathways. And we have seen that the body, once they take this protocol, and if you've got autoimmune disease, we want you to take it for 90 days. And we see that at the end of 90 days, everything is just talking the way it needs to. And this is measurable on our equipment. Now, maybe I can, because this is live and I can change things, maybe I will just pull up that screen on my computer. Let me see. Okay, so I'm going to turn this around so you can see my computer. Can you do that? Can I do that? Let me see. It's hard for me to see, but you should be able to see my screen here. So this is a grid, and blue is underactive, green is perfect, red is overactive. So what we want is this black line, which is today's trace. This is today's trace on that particular point. We want that to be in the green. Now the blue, if you can see the blue, this was the reading that we had before. So this is a technology that we have here in the clinic so that we can actually test where you are, we can test what your vibratory frequency is, and we can test what is impeding that. So if that gives you some kind of an understanding with that. So some things that go with the fibromyalgia. We've got a swollen, tender lymph nodes. Well, that's your lymphatic system. Cognitive dysfunction, you're just having those senior moments, and even though you're not a senior, I'll just tell you, I don't have very many senior moments, and that's because I do detoxing all the time. I take a formula that we have here in the clinic. I take it every day, and I don't want to have mental toxicity. I don't want to have emotional toxicity. I don't want to have lymphatic toxicity. I don't want to have liver toxicity, because all of that impedes cellular communication, and it's only, I think of it this way, right? Everybody has cell phones, so this isn't going to make sense to you if you are a millennial. But back in the day when we had analog phones, there would be a thunderstorm or some kind of solar flares or whatever, and you would have the handset to your ear, and there would be just a lot of static, and you couldn't hear what the other person was saying. On your cell phone, when that happens, you'll have missed words, dropped words, you'll have bands of silence, because you're just not getting that communication. Well, that's what happens in the body, and when that happens in the body, then you're not able to move forward. So men and women, if your hormones are messed up, you're not getting cellular communication. If you're depressed, you're not getting cellular communication. If you're Interpersonal relationships are not good. That's a stress on the body, and it can impede your cellular communications, your bacterial, your fungal. We eat so much sugar. It's in the processed food that it absolutely engenders pathological fungus in the body. And so all of these things impede cellular communication. And so that's what we want to stop. Sleep disorders often accompanies the fibromyalgia. Thyroid dysfunction. It is estimated that 80% of women have subclinical thyroid issues, and we see that in the clinic. So there's just a lot of different things for that. Now, this is from the National Fibromyalgia Association. Sleep problems can impede your problems. When they've done the testing, they find that people with fibromyalgia do not go into deep sleep. It says they have bursts of awake-like brain activity that causes them not to go into that deep restorative sleep. Stage 4 is what they call it. Here are some other overlapping symptoms: restless leg syndrome, rashes, dry eyes, dry mouth, anxiety, dizziness, vision problems, neurological symptoms, and impaired coordination. Okay, so that's just kind of crazy. People with fibromyalgia look healthy. Their blood tests say that they're healthy, but they are in chronic pain all the time. So this brings us to another difference between your medical and your homeopathic or your holistic approach. So in the medical approach, if your blood work looks good, they're going to say, oh, you're making it up in your head because your blood work looks good. Well, we don't say that because we trust you. We believe that you know your body more than anybody else knows your body. And if you're telling me that you've got these problems and I'm testing it on the avatar and I can see that you have the problems, then we know that you've got a problem, right? So we've got another tool. Let me see if I can get that up for you. And it is called an HRV, or a heart rate variability monitor. Let me just see if I can pull that up for you. And I can. I certainly can. So let me... All right, let me get this up. All right, so I'm going to turn again to my computer. See if you can see. This is a really, really pretty. I'm going to turn this more towards you. Is that better? This picture's not all that pretty, but let me show you this picture. This picture shows the brain, okay, and then it shows the different brain waves down here. So when your brain is functioning perfectly, right, you've got a lot of movement through the different brain variances or the different brain frequencies. These are the different brain waves. And so these are tools that when we watch this, we can see if the intracranial, like this intracranial pressure is normal, but in a lot of times this will be abnormal. And what this tells us is there's something going on in the liver. If this is a high or out of normal range, what this does is tells us that there's something wrong with the liver. We've got this little pyramid. These are all of your hormones right here. This is your energy production. Are you having the right kind of energy production here? And all of these things tell us something. So even though your blood work is perfect, and we love perfect blood work, if the body's not functioning the way the body should function, then we get all these mysterious diseases like fibromyalgia, and there's no blood test for that. It's just you telling the doctor that you've got this pain, and you've had this pain for 3 months or more. So I hope that helps you with that. Let me see. What will help? Okay, what will help fibromyalgia? So these are some things that the doctors say will help. pharmacological activities, exercise, self-management, cognitive behavioral therapy have demonstrated help in fibromyalgia. Alternative therapies include massage, myofascial release. Now that is a massage technique that actually calms down the muscle fibers and releases the tensions there that's causing the pain, right? Acupuncture, chiropractic, herbal supplements, and yoga are effective tools for managing the fibromyalgia symptoms. Increasing your rest, pacing yourself, reducing stress, practicing relaxation, and improving your nutrition can also stop the symptoms, minimize the symptoms, and increase your quality of life. Now, if you want to know some different supplements that will help you, I'll give you a little list here. You want to get off of an inflammatory diet. Even though it says that it is not an inflammatory disease, there are foods that do cause inflammation. Inflammation always causes pain. So even though fibromyalgia is not listed as an inflammatory process, if you're eating foods that cause inflammatory, then you're going to, as a byproduct, encourage pain, which is going to make your fibromyalgia symptoms even worse. So we're going to give you an anti-inflammatory diet there. We want you to take magnesium, at least 500 milligrams of magnesium. Now, a lot of people don't want to take magnesium because even though it's a muscle relaxant, even though it calms down your muscles, if you have too much, it can make you have diarrhea. Well, we've got a good brand that is formulated in such a way that it will not give you diarrhea. So that's something that you could look at. 1,000 milligrams or 1,000 IUs of a good fish oil every day. Fish oil is anti-inflammatory. Now, 1,000 milligrams is a lot. You don't want to buy a cheap fish oil at your big box stores because they are more than likely contaminated with mercury. And mercury is a neurotoxin, and it's going to inflame the brain, and it's going to impede your cellular communication, so you don't want to do that. You want to take at least 5,000 IUs of vitamin D daily. Now, I say you want to take 9,000 IUs of vitamin D, and that is a lot, but we've got it in a liposomal spray that you just spray inside your cheek, and it doesn't taste bad, and you get 100% of the benefit because it doesn't go through the digestion and it doesn't go through your liver. You want to take 5 grams of D-ribose daily, so this helps reduce pain and fatigue. You can also take 1,000 milligrams of ashwagandha and rhodiola. They reduce inflammation. Now, I don't know why the doctors say that these things work, and then they say that fibromyalgia is not an inflammatory process, but that's what they say. You can also take 1,000 milligrams of turmeric. Now, let me just explain about turmeric. Turmeric is not bioavailable. The curcuminoids in turmeric do not lend themselves to absorption into the body. There are 2 brands that are treated in such a way, they're manufactured in such a way that it enhances the absorption. One is by 9 times, so it's 9 times more bioavailable, and the other one is 20 times more bioavailable. So which one am I going to pick? I'm going to pick the one that is 20 times more bioavailable because you know what? When I'm in pain, I want that pain to be resolved. I broke my toe about 2 years ago. It may be coming up to 3 years now. I lose track of time. But when I broke my toe, I just popped it right back into place and taped it to my other toe because that's what they're going to do if I go to the doctor, and I don't want to go to the doctor, and it was late on a Saturday evening when I did it anyway. And so I just taped it up, kind of hobbled home, and went to bed. Well, I woke up in the middle of the night, and my foot was throbbing. My toe was throbbing. And so I got up and hobbled down the hallway to where I had my supplement, and I took 4. and within 20 minutes, my toe stopped throbbing, and I was able to go to sleep. And so whenever that pain would come back, I would just take 4 of those, and I was pain-free. Now, I didn't have to do that for long, but when I'm in pain, I want something that's going to work for me, right? Because I don't want to be in pain. So my calendar is telling me that it's 12:30, and that means our time is up. Thank you for watching and joining us. Please share. Please let me know what you would like to talk about, because I definitely want to help answer your questions. So just to sum up what we talked about today, fibromyalgia is a mystery disease. Nobody knows what causes it. There's no drug for it, but if we get the cells in the central nervous system talking to each other again, which we're very, very good at doing, then I believe that you could have better quality of life and you would not have to live in a pain-filled environment. So this is me, Dr. Polly, telling you goodbye. Have a great weekend. Be good to yourself. And for all those moms out there, happy Mother's Day. Be blessed.